And welcome back to Western New York Living. From allergy problems to tonsillitis, otolaryngologists, or more commonly known as ENT specialists, can help treat problems of the ears, nose, and throat. Here to shed more light on these conditions and what else can be done is Dr. Paul Young. Thanks so much for being here today.
Oh, thank you for having me.
I think so many times we don't think about our ear, our nose, and our throat all being connected, you know, and so sometimes when your ear hurts, it can be linked to other problems, can't it?
Absolutely. So the ears, nose, and throat actually have common pathways where they drain to, and so anything affecting the nose can secondarily affect the ears, throat.
This time of year, a lot of people are dealing with sinus issues. Let's talk about how you can help relieve some of these issues.
Certainly wintertime in Buffalo is a time where people get a lot of sinonasal problems, congestion, sinus infections, allergy type symptoms. There's a spectrum of treating these things. One is with medicine, and if the medicine doesn't work, then there become surgical options.
And some of the surgical options that you do are very interesting. Tell me about those.
So they're traditionally surgical options for sinuses are in the operating room with biting instruments that make the openings to the sinuses larger. That way they drain more efficiently. There's an option that is newer in the last 10 to 15 years that's become available, which is minimally invasive and is, rather than biting the tissue, stretching it with a balloon.
And so it would be sinus balloon
Dilation.
Dilation. And how have the results been with this?
So results are great. The published results in the literature show that they're equally as efficacious as doing traditional sinus surgery.
Wow.
Certainly there can be failure rates, but there are failure rates to both, and that are comparable. So results are great, and I can tell you in my practice I've had excellent results.
Are you seeing the same kind of results? Do you do this for children and adults?
It can definitely be done for children. The difference with children is that with children it's always done with them in the operating room asleep. With adults it can be done with them awake in the office.
How long is the procedure?
Patients that come to my office and have it done, they're in the office for less than an hour total. Most of that time is getting them comfortable and getting them numb with local anesthesia. And the procedure itself, 20 minutes.
What's the recovery afterwards?
The recovery in my experience with my patients is less than 24 hours.
Wow. Do you have people calling you and just breathing in on the phone and like, doctor, listen to me, and then they just breathe in and out?
Yeah, it's really, really gratifying to have patients come back and tell you how just this week I had a patient come to me and tell me that she hasn't had a migraine since I did this.
Wow, that's a big deal. And I would imagine too that this could be kind of a cause of sleep apnea or just like disrupting sleep if you can't breathe through your nose.
Sure. So again, ears, nose, and throat are all connected. So certainly sinonasal congestion, swelling in the back of the throat can certainly be all connected to sleep apnea.
What about this time of year with nosebleeds? Because I know a lot of people deal with that. What's the best way to handle that?
So once the dry air comes on and forced air and the temperature changes, and a lot of dryness is the key.
Okay.
So with nosebleeds, we see a lot of nosebleeds in an older population, people on blood thinners. The key is to keep the nose moist. And there are moisturizing agents that you can put in your nose.
Like the saline sprays?
Saline sprays. There are gels that last a little bit longer than the saline sprays. And keeping the nasal environment moist is really a key.
Do humidifiers and those kind of things in the house help?
They do. Humidifiers do help.
Okay.
Yeah.
And congestion also an issue this time of year. What can people do to alleviate congestion?
Well, mostly for congestion, especially this time of year, again, it's keeping the nose moist, number one. Sometimes you need to decongest the nose, and there are different medications depending on each individual person. I mean, you can't give a blanket statement because it depends what the underlying cause is, but it may require a nasal steroid spray, some nasal sprays, maybe some antihistamine type medications.
And one final question, when does congestion go from I'm congested to it's time to go see you?
Yeah, so if you're congested and you haven't had any relief after a number of, after the traditional 1 to 2 weeks that a cold lasts, you go to your primary care doctor and they've given you some medications that are really not cutting it. The next step may be to go see a specialist to see if there's something, more media underlying that you need to take care of.
Sounds good. Have a happy New Year. Thanks
You
for
too.
stopping
Happy
by.
New Year.
Paul R. Young, MD, is located at 4955 North Bailey Avenue in Amherst, where they're equipped to take care of all your ENT needs, including allergies and sinus problems, hearing loss, tonsils, adenoids, ear tubes, and so much more. If you're interested in learning more, give the knowledgeable staff at his office a call, 832-8500, or check out their website at paulyoungmd.com.